My father-in-law was, as you know, he fought that for so long. It's kind of hard to remember exactly when he was detected with prostate cancer. Even when he even told us that I think he even maybe knew it, but didn't inform all of us because he didn't want us to worry. My husband and I both come from really large families. He has 7 siblings, and I have 8 on my side. And so I think a lot of times, they don't want to involve too many people or, get us all worrying about it and what have you. But when we all found out about it, we knew that, he had it, and we knew that he was, taking some medication for it. And then later, like I said, about 3 years ago, he lost his fight. So, and we lost him. But, like I said, it was probably 15 years worth of, constant tests. He went through the radiation and the chemotherapy, and, in the end, he knew that, those were some of the things that he needed to address, and he fought hard. As soon as she knew about my dad's, procedure and what he had, and she had pretty much said that 50 and above is, definitely the time that you should really start, being checked more often. The history, of course, of my father having, his diagnosis, she just recommended that, it'd be a good idea to, go ahead and get started and address it, Our town has a program called Road to Recovery, and it's a great program where you pick up patients that maybe don't have transportation to the cancer appointment. So it's through the Cancer Association, but Road to Recovery is like a program that is just affiliated with the Cancer Society, and they get a hold of us and tell us that there's people that need to go either to Indianapolis or the VA hospital or even just to the Columbus hospital for their radiation or chemotherapy, or even just a doctor's appointment, a follow-up appointment. And so they contact you, and then you hook up with that person and you take them to their appointments, and then you take them back home. So last week I had a gal that I took to her appointments the whole entire week. Like, I had her on Friday, and then I also took her Monday through Friday. And it's really funny because, a lot of times they need assistance as far as just wheelchairs, and, you need to, you should really get to know the person. I mean, because it's like, every day you're picking them up and taking them, and you visit with them, and you kind of learn a little bit of their background, and it's just kind of, it's a great program, and it kind of makes you realize just how fortunate you are to have your health, and that you're not, in circumstances like they are. So, and I enjoy doing it.